Good day, I am Brion from BSN1B, and today I will perform an assessment on the abdomen, anus, rectum, and the prostate of our patient. So the first thing that we have to do is, of course, introduce ourselves to the patient and explain to him or her what we are going to do, as well as to do proper hand hygiene. So I have here my alcohol and I am doing the proper hygiene. Okay, so now we are going to introduce ourselves to our patient and explain to him what we are going to do. So the first assessment that I'm going to do is the abdomen. So, ma'am, I am going to assess the abdomen so that we can avoid any further problems regarding to your abdomen that you may occur in the future. Is that okay with you, ma'am? Okay, so now that I am done explaining to the patient what I am going to do, we are going to close any door or any curtains that are open so that it can provide privacy to our patient. So now we are going to undress or help the patient undress. So if the patient needs to undress or needs help, let's assume that my patient is done undressing and he or she puts on the gown already. So we are going to proceed to the abdomen of the patient. So I'm going to open this. And then we are going to put on bath towel to the exposed body of the patient. There we go. So now that the abdomen is exposed, we are going to check for any lesions and then the skin color, any rashes around the abdomen. Okay, so let's check. Okay, so we have to check if there are any scars like that. So as I can see, there are no signs of scars or any rashes, any lesions on the skin or the abdomen of the patient, and the skin color of the patient is also normal. So now that we are done with that, we can now proceed to the auscultation. Okay, so we are going to auscultate the different quadrant of the patient's abdomen. Okay, with the use of my diaphragm, we are going to check the bowel sounds of the abdomen of the patient. Okay, so now let's assume that I am done with that and all the sounds of the abdomen of the patient is normal. So now that we are done with the auscultation, we are going to proceed now to the percussion. So we are going to tap the abdomen of the patient. We're going to percuss it and check if the abdomen sound is normal. Okay, so now that I am done with the percussion, we are going to palpate the abdomen of the patient. So in palpation, we are just going to palpate it lightly first before going to the deep palpation. So we are going to ask the patient if he or she feels any pain while we are doing the palpation. So do you feel any pain po? Okay, so now that we are done with that, we are going to the deep palpation. Okay, so now that we are done with the palpation, with the deep palpation, the percussion, and as well as the auscultation, we are going to check if the patient is okay or comfortable, and we have to check what the patient response is to what we do. Okay, so we have to take note of the patient's pain or if there is any. Okay, so something like that. Okay, so now that we are done with the palpation as well as the percussion and the auscultation, we can now proceed to the other assessment and put on the clothes of the patient as well as the blanket and the bath towel to its natural self. Okay? Okay, now that we are done with that, we are going to continue to the anus and then the rectum as well as the prostate assessment. Okay, so now that we are done with the abdomen, we are going to proceed now to the anus and the rectum as well as the prostate of our patient. Okay, so the first thing that we have to do is to perform hand hygiene. And then we must put on some gloves. Okay, so this is the PPE that we need in order to do the assessment. Okay, so now that we are done wearing our gloves, we are going to proceed now to the buttocks of our patient. So let's assume that this is the buttocks of our patient. Okay, so I don't have any clay so that for the buttocks. So this is let's assume that this is the buttocks of the patient. Okay, so now that we are going to proceed with that, we are going to check now the surroundings of the buttocks of the patient. So let's make sure that there are no any lesions, any scars, any redness, or as well as swelling of the surroundings of the buttocks of the patient. Okay, so let's observe, let's check if there are any abnormalities. Okay, so as I can see, there are no abnormalities on the patient's buttocks. Okay, so now that we are done observing the surroundings of the patient's butt, we are going to put on some lubricant gel or lubricating gel to our gloves, our hands, and then put it on the anus of the patient. So let's assume that this is my lubricating gel. So we are going to do this. And then we are going to put it on the buttocks hole. Okay. And then we are going to observe any swelling or any tenderness that there is. So we are going to check for any tenderness. Okay, so after that, we are done with the assessment on the anus and then the rectum and then the prostate of our patient. So we just have to check it and then make sure that our patient is comfortable. So now that we are done with that, we can now put it back on its normal and then put the patient back to its normal position. Of course, we have to remove our PPE first. And then perform hand hygiene. Then now we can go help the patient in going back to its position. Okay, so now that we are done with that, we are going to say thank you to our patient's time and effort while we are doing the assessment since they cooperated to us. So, ma'am, thank you for your time po and cooperating with the assessment. I hope that you are comfortable within the whole assessment. So, everything that I assessed is normal. Okay, so your abdomen, as well as the bowel sounds of your abdomen, There are no skin lesions or any scars on that, so all of it is normal, as well as your anus and your rectum. Okay, it is all normal. There are no swelling, or there are no any abnormalities I occur. Okay, so all of it is normal. You are normal, and then I am going to put you on the other nurses for other assessment. So thank you po, ma'am.